So I have no way of knowing who's watching this video and whether or not you have any history of self-injury yourself. So I would like to mention that the presentation may include some graphic descriptions, and I would like everyone to take care of themselves as needed as we go through the presentation. So the biggest challenges with self-harm is really people who don't understand. So most often people will tell me that they told somebody and the response was very negative. The person became shocked, very angry, very disappointed, a lot of strong emotions. And their typical result is to just tell the youth, just stop doing it. Don't do that. You know, that's not good for you. Just stop doing it. And the youth always come and say, well, don't you think if I could just stop that I would have already stopped? Like, how is that possibly helpful? So they get shock, they get anger, and then they get told simply to control themselves. And so they find telling people not to be helpful. And people label them as hopeless. There's nothing I can do for you. I can't help you. And that is, so people don't seek treatment because they're afraid that people will not understand. That the therapist will not understand, that they won't be able to give me any other ways to get out of this or make these changes. And that again creates that sense of hopelessness that makes a person stay in the place where they are instead of looking for change. So if we look at a model for understanding self-injury, how do these pieces happen? So what happens is there is a trigger event. Something happens that is upsetting. That creates thoughts. So typically the thoughts are markedly negative, critical. They typically have what we would call cognitive distortions. So they're very black and white thinking, or they're mind reading kinds of thinking, or they have unreasonable conclusions that they're drawing about things. And those thoughts, it's the thoughts, the interpretation of the trigger situation that causes the strong feelings. And then the feelings create some self-talk. Oh, well, you should do this, or you're stupid and you're worthless and you should be punished. That type of negative self-talk, which leads to an action. In this case, we're talking about the self-injury piece. And then also leads to the reaction of, oh my God, I can't believe I did that again, which then again becomes another trigger and creates this sort of cycle or loop. So this is where we're seeing people who are self-injuring multiple times a day because they're cycling through that very quickly. So a big question that people have, I'm assuming when watching this type of video, is how do I help? So the most important thing that these youth need is your acceptance and your support. So how you respond to what it is that's going on and asking how you can be helpful is much more useful than being angry. It's much more useful than punishing or consequencing them. Most of the kids will tell me that they end up grounded after they've told their parents. So they end up punished so that their parents can watch them all the time, which then becomes a trigger in and of itself. Listening, really listening to people is a very important part of helping. Not making assumptions, not jumping to conclusions, not trying to jump in with how that needs, what they need to do to fix this or how to make it different. Just listening to them and making sure that they feel heard, and then asking them what it is that you can do. So trying to understand that today is as big as it gets, and they literally may not believe that tomorrow will get better. So teenagers are famous for having sort of a catastrophic, world-ending view about something specific that happened today. And from an adult's point of view, we might be like, well, 2 days from now, somebody else will do something equally stupid that will be the talk of the school, and you will no longer be the talk of the school. But they don't really believe that, and they don't really buy that. So when there's something significant that happens, it is as big as it gets. A conflict with a friend, an argument with a boyfriend or a girlfriend, being centered out in school, tripping in the hallway, whatever those things might be that can be drawing strong emotions. Those are as big as it gets. And one of the things that teens will often say is they just minimize what I've talked about. They tell me it's not a big deal and I should just move on and get over it. And it just isn't that easy for them. So making sure, again, if you're listening really to what it is that they're saying and being empathic and being in the moment with them, hopefully you're not going to have those responses of minimizing what it is that's going on. So your shock and fear and panic typically will come across as anger. They will see that you're mad at them. And really what you're angry about is the ability, the difficulty with figuring out that you didn't know what was happening, that you didn't know this was going on, you don't know how to help, you don't understand what it is that's going on, you're shocked, you're surprised, and typically that does come across as anger. And so people get criticized, they get yelled at, they get punished, as I mentioned. A lot of kids get grounded, so you can't go out because I can't trust that you're not going to self-injure while you're out. So those kinds of responses are certainly not going to make it likely that they're going to tell you about it again. You want to create again that open lines of communication. So it's a key piece is to understand that the youth is in pain and that they are trying to cope with it the best way that they can. This is the best that they can do. If they had a better way to do it, they would choose that, right? So they're doing the best that they can. Understand that self-injury is helping them deal with their life right now, and for some people it quite literally keeps them alive. It keeps the emotions in check enough that they're not suicidal, that they're not being admitted to hospital, that they're not making suicide attempts. And so while it's very difficult for us to understand, part of the key piece is that this is a coping strategy. It is helping them manage their life. It's not the best choice. It's certainly a harmful choice, but that does not mean that it isn't helping for what it is that they're going through. It's important to look at why they're self-injury, not how they self-injure. I don't need a graphic description of how many cuts they made or how deep they went or how much blood there was, or, roll up your sleeves and show me. I want to know what happened. I want to know what was the strong feeling that you were having, and is there some other way that we can look at doing something with that. Understand that you cannot stop the person from self-injuring, that power struggles are ultimately futile, so you cannot force them to stop. One of the things that often happens when a youth is self-injuring is they end up taken to the hospital, and the hospital staff advise them that they should lock up all of the sharp objects in the house. So lock up all the knives in a toolbox so that every time somebody needs to eat dinner, we're going to focus on the fact that nobody can have knives in the house because this person is self-injuring. But the reality of it is that they don't need to use a knife. That they can use a pop can tab or a piece of a pop can or a rock or the zipper on their jeans. That controlling them in that way is only helpful if the youth finds it to be helpful for those sharps to be locked up. In many cases, the youth will tell me that the minute somebody tries to lock up all the sharps, they become 100% focused on making sure that they can get something in case they need it. And it actually makes the self-injury worse. But for some youth, they will say, oh no, it's really helpful that if somebody has taken all of these things, and then that causes me to have to stop and think a little bit more before I can do it if it's not immediately accessible to me. So in terms of suicidal ideation, because suicidal ideation can certainly be a factor for someone who is self-injuring, even if the self-injuring is keeping them from being suicidal, it doesn't always work. So it's important that you are not afraid to ask about suicidal ideation when a youth appears to be despondent or hopeless or very depressed. We do want to check that out. We want to create an environment that allows that to be talked about. So asking about it is not going to cause them to do it. It's not going to suggest the idea to them. They're not going to say, oh my goodness, I had never thought about killing myself. Thank you for the idea. Now I'm going to go do it. So you don't need to be overly concerned about that. But by asking about it, it does set an environment that allows them to know that you're okay to talk about it, and that there is an environment that they can express that if they're feeling that way. And it's really important to understand that suicidal ideation is very different from having a plan or an intent. A lot of teenagers have moments in time where they feel suicidal. They wish that they were dead. They wish they had never been born. But that doesn't necessarily mean that they have some kind of plan or any intent that they would actually do something to harm themselves. So those thoughts can be very fleeting. They can come and go. And happen to a lot of youth, a large percentage of youth at any point in time. So it's a very, very different piece. It's not to panic if they're saying that they're thinking about something suicidal, does not mean that they have a plan or intent to do it. So if the youth admits that they're having some suicidal ideation, first off, it's always really important to take that very seriously. We don't want to minimize that. We don't want to say, oh, okay, and then walk away because we don't know what to do with that. So if they're involved in some kind of treatment, it's important to consult with their therapist. Assuming the youth agrees, let them know so that they can talk about it. Inform their parents. If you're not the parents, send them to the hospital to be assessed if needed. Those kinds of things are very, very important pieces. We want to always take it very seriously. There's nothing worse for a teenager than to tell somebody that they were wishing they were dead and have the person do nothing about that. So in terms of coping strategies, because I think this is a really important part of this process. What kinds of things can we build in that will help the youth to deal in a different way with the stressors and the emotional reactions that they're having? So try to get the youth to generate a list of 5 positive coping strategies. The more portable the coping strategy, the better. So something that they can take with them. So having something that is only in their house doesn't help them if they're at school. So some of the examples of things that could go on the list is to find someone to talk to that you can trust. Go to a park and swing on a swing. Journal, write poetry, play with a child. There's something inherently joyful about small children usually, unless those small children happen to be your siblings who are really annoying to you. Taking deep breaths in and of itself, very, very portable exercise, very calming, very focusing if the person can learn to do that. Watch your favorite funny movie. Laughter is the opposite of being anxious, and so therefore it's a really good skill to draw on if it's at all possible to help reset some emotions. Painting your nails is a great idea because one, it gives you something to do with your hands, and 2, while your nail polish dries, people tend to want to make sure that the polish stays nice, and so it gives you a 10-minute window where they're not going to be digging through a silverware drawer or something in order to find something to self-injure themselves if they can hold off, wait for the nail polish to dry. Other coping strategies, very obviously, spending time with friends if they have good friends, carrying safe things with them like charms or crystals, little things that they can put in their pocket that act as a touchstone that can help them to stay grounded where they are, remind them of positive people, positive things. Going online can be a good distraction. I mean, there's a million different things that they could do online. We don't want them, however, to be going online to a self-injury website that is very graphic. What we're looking for is coping strategy things. So go online, watch YouTube on funny cat videos, or go talk to friends on a website. Different things like that would certainly do work. Ripping paper can be really therapeutic. Old phone books are great for this if anybody still has those things floating around, since nobody ever really uses those. Small things to do with your hands and your brain, little electronic games types of things work. In this day and age, of course, most of the teenagers have a cell phone. They can have apps, they can play different games, things like Candy Crush and Bubble Pop, where there's a kind of a lost time component to them, can be kind of useful. Soaking in a tub with bubble bath can be very, very relaxing for some people. For other people, there's a razor sitting on the edge of the tub, and certainly we want to make sure that that environment is safe. So if there's a lit candle on the side of the tub or a razor on the side of the tub, we want to be able to prevent and protect the person from, having those kind of negative distractions while they're trying to relax. And I always leave self-injury on the bottom of the list as long as they want it to be there. So try to pick 5 things. Again, this is by far not an exhaustive list, but I'd like to leave the self-injury on the bottom of the list as long as they want it there, because it is a coping strategy that has worked for them. It's not desirable, thus why it's at the bottom of the list, but I don't want to give them the impression that this is not okay anymore, because that can that it can act as a bit of a security blanket for them, knowing that it's still there, and allows them to have a little bit of latitude. It's sometimes very hard to, for example, come in and tell your therapist that you've self-injured again after several weeks' time, that they feel very much like a failure. So it's I think important to have some understanding and some attunement with how it is that they're feeling about the self-injury and the amount of fear that they have about moving away from that as their coping strategy, given that they've often had it for some time. So I think it's really important to leave self-injury on the bottom of the list. In terms of time frames, one of the things that people will often ask me is, how long, I want it to stop, and I want it to stop, not even now, yesterday I want it to stop. But for many youth, their moods can change really quickly, and for others, they can be very, very resistant to making change. Once they get stuck on something, I mean, we've all heard that teenagers can be very stubborn about things, and resistant to change. So certainly the sooner that youth can get help, obviously the better that is. But many people who self-injure sometimes take years before it's actually discovered, and then can take years to stop, and they usually have to make multiple attempts to stop. It's not unlike people trying to quit smoking or people trying to quit drinking, in that the average person takes about 6 times where they've tried to stop before they're actually successful in making that final attempt. So for most of the teenagers, they will come in and say, I'm trying, but I couldn't make it. And so I like to try to do a relapse prevention kind of approach, where if they went for 3 days or a week without self-injuring and then had 1 day of self-injury, we talk about that being 1 day within a week, not, oh, now you have to start counting again back at you've only gone 1 day without self-injuring, because I think that sets a different tone. With the starting your counting over again, how long it's been since you've self-injured, certainly sets up I failed kind of thought process, and isn't productive in helping them to understand that they are trying, and that they're working hard, and that they're doing the best that they can to move forward from this. And it's important to realize, too, that many people will go from one form of self-injury to another. So we might get them to stop self-injuring in the form of cutting, but then they may end up with developing an eating disorder or having a substance use problem if the root of the issue isn't dealt with. So most importantly, it's important to remember that teenagers can often be very moody. So their moods go up and down. They could be very upset and distressed about something at this moment in time, and an hour from now, it not be a big deal anymore. Or by the same token, leave a therapy session with a plan and feeling confident, and have somebody say something to them on Facebook 20 minutes later and they become suicidal again. So the moods are very fluctuating and very changeable. And so those kind of changes in relation to specific events are quite normal. They're perhaps a bit more dramatic than most adults would experience, but changes in relation to specific events are normal. And it's important, again, to remember that self-injury is a coping strategy. So people usually feel better after they self-harm, which is typically right about the time that everybody else around them is freaking out. So what happens is the youth is feeling very upset about something, they self-injure, they feel better, other people find out, other people react very strongly at that point in time. Meanwhile, they can seem to be minimizing or underreacting to what it was that happened, because the self-injury has helped modulate those emotions for them. So it is important also to seek professional help as needed. So where can you get help? So this is obviously an internet presentation. This program happens to be located in the city of Windsor in Ontario. So these programs are local for the city of Windsor. The Regional Children's Center at Hotel-Dieu Grace Healthcare has a walk-in clinic that operates Mondays, Tuesdays, and Thursdays from 12 till 6. The Teen Health Center has an on-call counselor and community crisis with the phone number there for, it's a 24-hour number for youth who are 16 years of age and up. If you are not in this community, I urge you to use the internet, seek resources locally that would be helpful for you. So I do hope that this presentation was useful in sharing some information. I thank you for watching and for being a positive influencer and helping youth.